Hi, my name is Amy Motley, and along with my team, Marla Lepley-Starr, Tina Jenkins, and Crystal Pendergraft-Horne, we are here to present to you our case study analysis of controlling the crisis for Nursing 814 Leadership and Operations Management. First, I would like to introduce you to Matt. Matt has been a unit supervisor for 5 years on a 25-bed medical surgical unit. Although for those 5 years things seem to be going pretty well, today Matt is faced with his first crisis that he must minimize and control. To give you a little backstory, a patient entered the unit with a stab wound that has been infected with methicillin-resistant Staphylococcus aureus, otherwise known as MRSA, on Monday evening. Today, Matt has found out that all 25 patients on the unit have a confirmed positive MRSA test result. When Matt found out, he initially audited the chart of the patient who entered the unit with the wound infected with MRSA, and he found out that the proper precautions have been taken and followed while caring for this patient. However, as we analyze the data, it implies that the patient with the stab wound is the source of entry of MRSA on the unit. The data also implies that at some point there was a breach in maintaining proper precautions for this patient as well as the other patients on the unit. Lastly, the data also implies that however the breach occurred, it has contaminated the unit with the potential to contaminate the rest of the hospital if not controlled. To respond to this crisis, Matt should contain the crisis by enhancing and reinforcing education and proper precautions for everyone on the unit. Matt may even want to consider restricting visitors to help minimize exposure. Matt should also communicate the current unit's exposure and the potential risk to other units of the hospital so that those who need to be involved to help minimize and contain this crisis has the ability to do so. While containing this crisis, Matt cannot forget to treat the crisis. Matt needs to ensure that all 25 patients on the unit have an effective treatment plan now that they are all tested positive for MRSA. As Matt is introduced to his first crisis, he may feel the need to apply leadership styles that he might not have used in the past. Leadership styles such as directive, which encompasses being commanding and authoritative, which provides clear instructions and expectations, he may feel may help turn this crisis around. Petalieri 2022. However, Matt cannot forget to use emotional intelligence. He may find pride in the fact that for 5 years, his unit has been crisis free. And he may want to focus on finding the source of how this exposure or contamination occurred. But he must remember not to react based off his feelings related to encountering his first crisis on the unit. He must determine how to collaborate with others and execute based on the facts that he is presented with.
Hi, I'm Crystal Pendergraft-Horne, and I am here to talk about whom Matt should collaborate with as he initiates the first stages of his response to the crisis. First, I'd just like to point out that it may be necessary for Matt to effectively influence his team and collaborators to navigate this crisis. According to Broom and Marshall 2021, transformational leaders appeal to a higher authority, which often results in high-level support. Matt could utilize his power and influence in helpful ways to grow on his own unit and to help the organization grow as a whole. Infection control should be reinforced on an ongoing basis, but specifically during an outbreak, including the use of competency-based training and monitoring, including practices like hand hygiene, environmental cleaning and disinfection, and using personal protective equipment. Those who are going to be key collaborators for containing the crisis include staff, patients, and infection control. Staff members are going to need up-to-date information on how to care for patients who have contracted MRSA, those who may be symptomatic versus asymptomatic, and patients are going to need to understand how to contain the crisis as well. Infection control will be vital to come in to match unit and to monitor how staff members are providing care and to monitor how they are donning and doffing PPE while caring for patients with MRSA. Collaboration and communicating the crisis. So as a leader, Matt is in an excellent position to help communicate the crisis. Matt can communicate the crisis with his staff. Staff can communicate the crisis with one another, with patients and families. The director of nursing can also assist, and we should collaborate with the director of nursing and communicate the crisis to them to see what they have in mind as far as recommendations. It may be that visitors are restricted during this time on that unit. The director of nursing can also ensure that proper policy is being followed hospital-wide and not just on Matt's unit. The infectious disease doctors and nurses are going to be excellent collaborators for communicating the crisis as they are utilizing evidence-based practice. And we know that nurses and doctors can communicate on different levels, which can be beneficial to all the members of the healthcare team. The ancillary staff, it's going to be really important to think about housekeeping and how housekeeping have to go into rooms and clean them. So we need to ensure that housekeeping or environmental services are trained on how to properly don and doff PPE. We need to encourage hand hygiene. We may need to speak to those in dietary and encourage those staff members not to go into contact rooms or patients who have MRSA on the unit, and maybe they communicate with the nurse or the NA and they ensure that the meal tray is delivered to the patient through either the nurse or NA, just to prevent any breach in PPE or any breach in aseptic technique or contact precautions. And then I think it's a good idea to communicate with the patient representative. Typically, hospitals have a patient representative who can assist, and they can clear up any misconceptions that either someone in the hospital have, or the public or patients or families have about exactly what is going on with Matt and the crisis on the unit at the time. So now we're going to talk about collaboration and treating the crisis. I have noticed as we have gone through the first 3 steps with collaboration, how we're containing the crisis, how we're communicating the crisis, and how we're treating the crisis, that some of the people of whom Matt will collaborate with overlap even within these different steps of how to address the crisis. So first, patient and families. Patients and families are at the backbone and the center of everything that we do. So when we come up with treatment plans, we certainly need to run these by the patients, and they may want to run them by the families. And contingent upon each patient, it may look very different what the treatment plan is, whether or not the patients are symptomatic or asymptomatic from MRSA, whether or not they have existing comorbidities, or whether or not they're immunocompromised. So the treatment plan is very individualized. Also, to treat the crisis, we're going to consult the physician and the infectious disease specialists. They will utilize the most recent evidence-based practice to guide and treat the patients on the unit who have MRSA. Nurses, as we know, nurses collaborate with the physicians to carry out those orders for the patients, and the nurses are the eyes and ears. And so although we will not be prescribing, we will still be directly treating the MRSA. So it's going to be important that Matt collaborates with his nurses on the unit and his other members of the healthcare team to ensure that treatment is being delivered timely and effectively, and that treatment is very individualized. Finally, I feel that Matt should collaborate with the lab and the pharmacy to ensure that lab work is processed in a timely fashion, particularly renal function or culture and sensitivity results, so that way treatment can be delivered to each patient. The pharmacy will also be in a position to help us treat the MRSA outbreak if the patients do require pharmacological intervention. The pharmacy will review that and help Matt and his team to treat the crisis. So now we're going to move into talking about Matt and how he is going to collaborate and expand this treatment beyond the hospital, and how he's going to utilize other access system resources.
Matt has thus far created a plan to manage this crisis. The unit has been overwhelmed with MRSA. So, what leadership qualities does Matt need to be successful? When considering transformational leadership qualities needed and emotional intelligence, Goldman 2004 tells us that there are 5 components in emotional intelligence that one may consider. When considering Matt, his motivation is the most important quality that our team considers for him to bring to the table. When we consider motivation, an individual's passion that goes beyond normal things like money or status is something that makes a difference when they have to face challenges like Matt is facing on the unit. The way an individual pursues their goals, a person who has the quality of motivation, their energy and the way that they have persistence and diligence and steadfastness impacts how they achieve their goals. Their drive to achieve in the face of overwhelming odds, they have optimism that when they face failure helps them to just pick up their feet and go the extra mile. And in the face of the MRSA on the unit with 25 patients who have been infected, trying to determine the cause and how to prevent the spread to the rest of the hospital, it can be overwhelming and catastrophic if the leader doesn't come together and create a plan quickly. According to Gallup 2007, leaders need to be analytical. Certainly, an analytical leader thinks through things, but you have to have a leader that can actually look at the data, be driven to assimilate that information, that can look at the facts and the figures and the numbers, that is comfortable in thinking logically, and who is a deep thinker and can make connections. We also want a leader who is an arranger. Those individuals are flexible. They're jugglers. There will be many tasks during this crisis that Matt will have to juggle. They align and realign. That's a good team member, an interdisciplinary team member, and that's one thing that Matt will have to make sure he's able to do. It's not just a nursing crisis, it's a facility crisis, and that takes on many different managers, different teams in order to combat this problem. And arrangers look at productive configurations. They're a conductor, somewhat like a railroad conductor. They see the rails and they get assets and products where they need to go. And so we really need Matt to be that conductor for us. And then we also need a person who is focused. That person is a point person. They're disciplined. They have a laser focus when needed. They see important areas that need to be dealt with, and they can prioritize quickly. They're a goal setter and a go-getter. And that's something that we need Matt to do for us. So overall, Matt is managing our crisis, and he has those skill set. And this is what we need for him to do for us and be for us. And it looks like we have an effective team.